In this video, I cover what specific history questions to ask when a client presents with low back pain and sciatica issues to help figure out exactly where the root cause of the pain is. Because if you don't know what the problem is, you sure as hell can't fix it. For those of you who don't know me, my name is Dr. Matt Maggio, and I am a non surgical expert in chronic pain treatment, specifically for neck, shoulder, hip, and low back issues. My focus is on finding and fixing nerves that become stuck to muscles with a glue like substance called adhesion, also known as scar tissue, and then reducing inflammation from chronic pain naturally without the use of medications or injections. This leads to a big increase in flexibility, functioning, and long lasting pain relief. I'm also the creator of the Peak Method, where we teach massage therapists a new treatment system that eliminates the frustration of inconsistent results and produces long lasting pain relief for their clients, all while working 50% less. All right, key questions to help figure out the underlying cause of low back pain and sciatica symptoms. Let's get right into it. A couple of key concepts and insights. I might sound a little ranty or like I'm scolding someone watching this, but these are some really important issues I see and mistakes that I made myself over the years. And I've seen this a lot in people that I've been training and teaching in my methods and my systems. I see this a lot with massage therapists. They say this idea, I can't legally diagnose, so why am I even bother trying to figure out what the diagnosis is? A lot of scopes say, yeah, you can't legally diagnose. You still got to know what the problem is. Because I said in the intro, if you don't know what the problem is, you sure as hell can't fix it. Next is be a clinician first, then a technician. All of us as manual therapists, we really just want to jump into treatment. We want to use our hands. We want to get in there. And a lot of times we're just doing a lot of like haphazard. I can't even say that word right. Yeah. Just a bunch of random treatment, not really knowing what to do. I always say this idea like be a clinician first, collect data, do measurements, do tests, so you know exactly where to go, then become a technician, because that's what's going to make your treatments more effective, longer lasting, and really getting to the root cause of what's going on. Next is quit trying to default to the one thing. I see this a lot in manual therapy, especially in courses and trainings. They're like, oh, everyone just treats the fascia, or all low back pain must just be the psoas. All sorts of different things. You want to default and you become what I call like a technique monkey or a technique junkie, where you're just jumping right in and you're like, instead of being like, what's really wrong with this problem here? You're like, hey, where can I apply my technique? And that gets back to like, being a technician instead of being a clinician first. Next is don't get stuck in the junk box diagnosis trap. You see this a lot. Anything that has like syndrome in it, like piriformis syndrome or low back spasms or anything you can think of, doesn't really tell us what's going on. We always want a tissue specific diagnosis. We want to know what the problem is, where it is, and exactly what is causing all of the pain. Because going back, we sure as hell can't fix it if we don't know what the problem is in the first place. Next is taking a proper history on everyone before getting started. And a history doesn't include just having them fill out some random form for a few minutes. You glance over it and you just jump right in. A lot of people are like, I'm an intuitive healer. I can just know where to go. Get the hell out of here with that. That's garbage. That's nonsense. You have no idea what you're doing. Take a proper history, ask questions, collect data, be a clinician, then become a problem solver. Another concept, symptoms are important, but they don't tell us everything. I think there's two camps out there. There's one camp that's like everything is symptom related. The other camp's like symptoms don't matter at all. It's somewhere in the middle. I always say symptoms kind of tell me where the smoke, it shows me smoke that there's a problem, but it doesn't really show me where the real fire is. So I do need to interpret the symptoms and understand, but I always don't want to go just chasing after symptoms. I want to understand why the symptoms are happening in the first place. And then this is so important. Don't fall in the trap of just doing a technique. People are like, oh, well, I do this, or I do cupping, or I do stretching, I do myofascial release, I do ART. Do you? This is a treatment. You don't really know what the hell's going on. And a lot of those courses, I've taken all of them over the years, they don't teach you how to diagnose. They just teach you how to do a treatment. And sometimes you get it, sometimes you don't. But you find yourself inconsistent with results and always wondering what the hell is going on. So a couple key history points to narrow down, especially in trying to determine where the low back sciatica presentation is coming from. A big question I ask on top of my other questions is always, would you rather sit for an hour straight or stand for an hour straight? This is really, really important. And if they say, hey, they'd rather sit, sitting feels better, I'm thinking in my mind that more than likely I have a sciatic nerve entrapment somewhere all the way from the spine down into the hips, even into the hamstring as well. If they say standing feels better, I'm thinking more it's like a lumbar spine issue, specifically in the deep lumbar muscles, supraspinatus, supraspinous. somewhere in there, but it really helps me get an idea of what's going on. I've already taken a thorough history where I asked like 12 really in-depth questions. We teach you that in our full free training course as well. But this really helps me differentiate like where I want to go. And if both are like, hey, both suck or both are causing issues, then you really get into your testing and your functioning. A lot of what I teach in my courses is like doing specific tests to know which one is the worst. And that's what I do for lumbar, hips and stuff like that is we grade, we measure, and then you go after the worst test, not just what the symptoms happen to be. So let's say that standing is worse and sitting feels better. I'm more than likely, I would say 80 to 90% of the time, thinking that I have a sciatic nerve entrapment at the external rotators. Most people think it's piriformis. It is not piriformis. Piriformis syndrome is nonsense. It's garbage. It has syndrome in it. Only about 5% of it actually comes from piriformis. What actually goes on is it gets stuck deeper on the superior gemellus. That's because we sit on our butts all day long. Nerve becomes entrapped. 80% of sciatic nerve entrapments occur in the superior gemellus. The reason this entrapment happens is people are sitting on their butt all day long. When that happens, it causes a lot of friction and pull in the area, in the muscle. Muscle gets a lot, doesn't get enough blood flow, oxygen, starts to lay down this stuff called adhesion, also known as scar tissue, gets inside there and eventually gets stuck to the nerve and causes all sorts of issues. Nerves do not like to be entrapped. The body has a hierarchy of things that it wants to protect. And when the nerve is entrapped, it will cause a lot of other things to change around there. Maybe the hip will roll forward. The pelvis might hike up because the body does not want the nervous system to be damaged, so it'll protect it at all costs. A lot of times, the client will also have very tight hamstrings that don't really relax with stretching or massage or anything like that because the entrapment is occurring because it's trying to protect that area. So, what I want to link up first, if you're watching this on YouTube, I'll link it right up top. It's a full detailed, like from start to finish with testing, palpation, treatment of the sciatic nerve entrapment at the external hip rotators. It was way too long to put in this video. If you want to watch it, I'll link it up top on YouTube. Anywhere else you're watching, it'll be down in the description box below. Next, we're going to get into if it hurts more with sitting. First thing I'm going to be thinking is the supraspinous ligament. Basically runs from the bottom of the sacrum all the way up to L1. Adhesion forms here because, once again, we spend way too much time sitting. When we sit, it stretches that ligament out, doesn't get enough blood flow, does not get enough oxygen, starts to lay down scar tissue. And at first, we don't notice it in the ligament because there's not a lot of pain receptors in there. But then what happens is now the area doesn't present how it's supposed to. A lot of times they might present with like some stiffness, some tightness in the low back, but like nothing too crazy, nothing really like angering it too much, but enough where they're like, hey, this doesn't feel right. The thing with the supraspinous ligament, you can't treat it with your hands. You have to treat it with an instrument. You can try with your hands, but you're not going to be able to get it. And the type of instrument really does matter as you go in there and treat it. And when you unload this and you get the ligament healthy, all the muscles anchor to that. So it's going to produce better stability, better force into the low back and just help things function a heck of a lot better. Almost like take some of the pressure off of the disc and kind of opens it up. Next thing I'll include is that treatment demonstration with all the details in it on YouTube right here up top. And as I said, down low really goes into the nitty gritty of all of it and really helps you understand more in depth how to go about treating it. You also see some links in there to the instrument that I like to use that I found to be the most effective. Lastly is going to be the lumbar multifidus group. You're especially going to see this in people that it hurts a hell of a lot more when they sit and it feels better when they're standing. So why does this area get so much adhesion? Once again, sitting. We're just sitting way too much from where we are. And typically what I end up seeing in the multifidus is I see like hypertrophy where the muscles are getting bigger, usually higher up in the thoracic spine, like from like T10 to like L2. And then down low, I tend to see a lot more in the lower lumbar, like from L3 to S1, but they actually form more atrophy. So you'll see like a thickening of the lumbar multifidus higher, but then where the problem actually is, there's a lot, it's like almost like thinning out, like it just kind of drops out. And that adhesion is just so common there because these muscles just really get beat to hell throughout the day with too much sitting. These muscles are really important in like stabilizing the spine, keeping things really neutral. But when you're sitting so long, they get inactive and then they try to kick on, but they can't. The multifidus are like really important in like stabilizing. So think if you go to like push a door open, that's like that counter force that goes in there as well. They're so important in lumbar stability and function. Next, I'll include the treatment demonstration. Like I said, detailed testing, palpation, treatment, everything like that. So you get a better idea. YouTube up top right here and down in the description box below. But these are the areas you really want to consider as you go. That's all I got in the video. I appreciate you watching. If you like the video, share any insights you might have gotten in the comment sections below. I try my best to respond to every comment and share some resources with you. Next is share this with other providers. You know, it might help. My goal really is just get better care to people so people can get better treatment, get better long lasting results, and actually get their problem fixed. And lastly, if you like what I'm teaching, you want to learn more, go download our free training modules. The links to do that are wherever you are consuming this. We really take you through the start to finish of the system, you know, being that clinician first, that technician second, and really getting that long lasting results for your clients. So you can get that reputation in your area as being a true problem solver. I appreciate you watching. I'll catch you on the next one.